Which of the following first radiological changes likely to be apparent in a plain radiograph in a 12 years old presented with suspected Perthes disease? So it is direct question that a boy or a patient who is 12 years of the old and suspected case of the Perthes disease. So what may be the radiological changes, or what is the findings of the X-ray? Here the options are multiple bone cyst, sclerosis of femoral head, loss of bone density, joint space narrowing, and collapse of the femoral head. So we have to find out one of the option which usually occurs in case of the Perthes disease. So let's say this is the Perthes disease. It is a avascular necrosis of the femoral epiphysis. So it is very, very important. It is the avascular necrosis of the femoral epiphysis of the femoral head, and it occurs and it impairs the blood supply of the femoral head. So there is the necrosis occur of the femoral head and causing bone infarction, as there is loss of the blood supply. As there is loss of the blood supply in the femoral head, so the avascular necrosis of the femoral head develop, and followed by the new vessel develop, and ossification also occurs again. The bone either heals or subchondral fracture occurs. So spontaneously this bone may heal, and sometimes there may be development of the subchondral fracture. So this is the Perthes disease. In case of children, there are three important bone disease. One of them is the DDAs, another one is the Perthes disease, and the third one, which is the SUFI or slip upper femoral epiphysis or SUFI. So it is DDAs, Perthes, and slipped upper femoral epiphysis. These three important disease occurs in bone in case of the children. So in Perthes disease, there is the age is the very important. Here we can see the Perthes disease. It occurs usually the age between the 5 to 12 years of the age. So the Perthes disease, it is the self-limiting disease. That means the disease occurs and it repairs spontaneously, and it usually occurs between the 5 to 15 years of the age. And DDAs, it occurs usually less than 5 years of the age. Perthes disease 5 to 12, and SUFI more than 12 years. So according to this age difference, it is very easy to remember and answer the question, because sometimes we forget the radiological finding or clinical finding, but if we can remember the age limit, then it will be very easy for us to answer the question. So this SUFI, it occurs between the 5 to 12 years of the age. DDA is less than 5 years, and SUFI more than 12 years. Here we can see this is the Perthes disease, and here this is the normal shape of the femoral head, but due to avascular necrosis occurs due to loss of the blood vessel or destruction of the blood vessel. So the avascular necrosis occurs, and the shape of the femoral head, it now represent like this. That means the damage, after damaging the shape like this of the femoral head. And what is the prevalence? Here we can see male are more predominant than that of the female. Age group 4 to 10 or 5 to 12, unilateral, more unilateral than that of the bilateral, and intermittent limp or worsen after activity it may develop. So it is in short about the Perthes disease, but the most important option to remember, which is the age group, which is the 5 to 12 year of the age. This is very important. It is 5 to 12 years of the age. Now here we can see the different stages of the Perthes disease. First of all, in case of stage 1, clinical and histological feature only, but in case of stage 2, there is sclerosis with or without cystic changes and preservation of the articular surface. So in case of stage 2, there is the sclerosis, and in case of stage 3, with sclerosis, there is loss of structural integrity of the femoral head. That means this is the normal shape of a femoral head, but when there is the avascular necrosis occur, in this condition, what develop here, a small portion a small portion usually remove and shape become like this, so there is loss of the integrity, structural integrity, and loss of the normal shape of the femoral head. And in stage 4 there is loss of acetabular integrity. That means in previous time or in up to the stage 3 there is only the shape changes in the femoral head, only the femoral head. In this 3 there is only loss of integrity of the femoral head, but in case of stage 4 there is the also loss of the acetabular integrity. And here the most important changes occur, which is the sclerosis. In case of Perthes disease, the most important changes occur, which is the Perthes, which is the sclerosis. So what is the most important radiological findings? In case of a 12 years age and suspected case of Perthes disease, there will be sclerosis of the femoral head. Other options here such as the multiple bone cyst, usually not true. Loss of bone density, actually the bone integrity loss, not the density. Joint space narrowing, here no option of the joint space. Collapse of the femoral head, it is also not true because there is no collapse. Collapse occur when there is osteoporosis. Here this is the avascular necrosis, not collapse.